Hello, I'm Sarah Day. This is my patient for today, Miss Koala. She's very unstable, so I'm going to hold her in place during our teach back video. But before we start, I wanted to talk about the things that I've learned in the module, the interventions that I think should always be practiced in a hospital. It just kind of makes sense when you're reading it. And it's kind of sad how many times that nurses kind of forget to include these interventions because, I mean, obviously as nurses we're very busy and there are other things on our minds, but I think that it's a practice that people should start implementing in the hospital because you never really realize how important it is and how we may know these things and understand these things, but our patients and our patients' families do not. And we also often forget that it's not just our patient that should be involved with this, it should be the family and the patient. So by doing this, I think like having patient and family advisors, healthcare team, like establishing the roles of our healthcare team, bedside shift report in front of the patient, and like making sure they're super engaged is such a big deal. Do report in front of them, include them in it. That way, if they have questions, they can stop and ask you. That way, they're not left out of it because ultimately it's their decision. And then effective discharge teaching. So, Miss Koala, today we're going to be talking about your new diagnosis with type 2 diabetes. And your doctor asked us to go over your new medication of metformin. So first I'm just going to recap about type 2 diabetes. I know he explained it to you, but if you have any questions, please let me know. It is a disease where your body cannot effectively use the insulin that you have and lower your blood sugar levels. So your metformin is going to help aid that production, more of a action of your body using that energy and that sugar, because right now your body can't really do that. So I'm just going to give this to you because, as I learned in the module, having easy to read pamphlets and stuff that you can easily use. It's right there. Okay. It's understanding metformin and your type 2 diabetes in simple terms. Okay. Anyway, so yes, again, like I said, your doctor has prescribed metformin, which is a medication that you're going to take by mouth twice a day, once in the morning and once at night. You are always going to take this with meals. One of the most common effects of this medication is GI upset, which means your belly might hurt after taking it. And so to hopefully prevent that, we're going to ask you to take it with meals and water. And if you do develop severe stomach aches or anything that you feel is abnormal, please give me a call, your doctor a call. But do not stop taking this medicine abruptly. I think that you should have a set schedule with it. Set a reminder on your phone. Ask your family member who's in the room with us because they are trying to be engaged in this conversation. Make sure that your wife, Mr. Koala, has a timer and that she is effectively taking this medicine on time and she doesn't forget it. And if you have any other questions or issues, just call us, and then we'll see you back here in 3 months to recheck your hemoglobin A1Cs, which is the test that we use to see how your blood sugar is doing over a span of time. So let me reiterate that. It's a span of time. It's not just in the past 24 hours. It's over your 3 months. And our ultimate goal is to keep that below 7, which is why we have you on metformin, because right now yours is above. So Miss Koala and Mr. Koala, I'm glad that you were here and present for this. That way you also understand. But I'm going to ask you to demonstrate your knowledge back to me of what I just taught you. This is lets me know that you know what you're talking about now, but also that I taught you everything that I needed to for your safety. So I'm going to ask you to just tell me the medication that you're going to be taking, how often you're going to be taking it, what are some important things that you should know about the medication that you're going to be taking, and when you would need to call us, okay? Well, So you're saying that I should take my metformin twice a day with meals and water, and that it might make my stomach upset. And if it makes my stomach too upset, I should call you back. Yes, that's right. Okay. And I am going to be seen back in 3 months to recheck my sugar levels that are over a span of months, not just a span of 24 hours. Yes, you are correct. Do you have any questions for me? Nope. I'm good. I'll see you in 3 months. And Mr. Koala, do you have any questions for me? Nope. I'm good. Okay, well, if you have any issues or anything, please feel free to call the office. Call me or your doctor, and we can answer more. And please read with your understanding metformin and type 2 diabetes new diagnosis.